Welcome to you all to today's webinar from Wevolver. I am your host, Samir Jaber, and today we'll be talking about powering the future of digital health. We'll uncover how Edge AI, and in particular, ultra-low power AI, is enabling smarter patient monitoring. We'll look at how Ambiq's proprietary spot technology or subthreshold power optimized technology is pioneering body-worn AI, wearable AI, and remote patient monitoring solutions. Now, if you're new to this space, allow me to tell you a bit about Wevolver. Wevolver is a global platform and community that provides engineers with the knowledge and connections to develop better technology. Now, millions of engineers and developers like yourselves leverage Wevolver to stay up to date, to find the knowledge they need when they are developing products, and leverage the platform to make meaningful connections. Now, this webinar, for instance, comes from the recently released 2025 Edge AI Technology Report, of which Ambiq was a key sponsor. And this was an in-depth report about the current state of Edge AI and a view into the future of this technology. Now, if you haven't downloaded this report yet, the link should be in the comments. You can check that out. So now that's out of the way, let's meet our guest today. With me is Mr. Carlos Morales. Now, Carlos is the VP of AI at Ambiq, focusing on advancing AI across extensive mobile and portable devices within the IoT universe, using Ambiq's Spot platform, which we'll hear a lot about today. His strategic focus includes pioneering low latency AI-driven applications while reducing and minimizing energy consumption through the implementation of local intelligent analytics. Now, Carlos brings over 3 decades of R&D experience from silicon to cloud, and he's had a distinguished career marked by significant technological innovations. I'll leave it to you, Carlos, to tell us more about it. So, Carlos, welcome. It's a pleasure to have you here.
Thank you for having us, Samir.
Great, Carlos. So before we dive in, could you tell us a bit about your background and what led you to work at this intersection of AI and so-called ultra-low power technologies?
So the crazy thing is, I think before my career started, I was writing firmware. Right? As a kid, that was what you did. I was just a super nerd. And when you're writing firmware for things like 6502 or Z80s, every cycle counts. I leave that behind. I go do all these crazy things in Silicon Valley. I go into AI. So I started working on AI back in 2016 at a company called Nirvana, a startup that was doing these 400 watt, 600 watt accelerators, right? Very different from the world that I'm working in now. And then I hear about Ambiq. And actually, the first time I heard about Ambiq, we were talking about the 10x power advantage. And you hear 10x and you think 10%. And then you listen to it again, like, no, that's 10x. And so that got my attention. And so you start imagining what you can do with a 10x power advantage. Even back, 5 or 6 years ago, that was huge. Now that we're scaling out AI everywhere, this is existential. Without a big power advantage, you really can't get good AI everywhere.
Absolutely. Well, I mean, let's talk about Ambiq for a minute. I mean, for those who may not be familiar, how would you describe Ambiq's mission and where maybe the spot technology fits into the so-called sort of the broader landscape of Edge AI and digital health and healthcare?
Right. So going way back to where it was started, it was started by our founder Scott Hansen, whose research project back in his university days was subthreshold operation technology. And that was well over a decade ago where this started. Now, subthreshold, you may have heard about it, is where you take a transistor's voltage levels and drop it to where the textbooks say they should stop working, right? Transistor isn't this digital thing. It's actually an analog device. And it just doesn't work as well as you lower the voltage. And it gets to the point where it shouldn't work. And so that's not true, right? If you have very carefully set up the environment, you can make a transistor work at very low voltage levels.
Mhm.
I mean, the reason to go through all that work is because power is a square of voltage. So you drop the voltage by half, you get 4 times better power. So the gains to be had from this kind of work are huge. Um, but first you have to solve all these problems. Like if you sneeze on one of these things in the lab, it stops working. If you shine a light on it, it starts working. If you, uh, uh, you know, it's a transistor, so there's a million little transistors on there. Each one is going to be slightly different, right? So all these process variations, temperature variations, voltage variations. As your battery winds down, voltage is changing all the time, right? So you have to take all that into account and turn that into a practical thing. So with that in mind, with all those problems in mind, Ambiq set out with this mission to take intelligence everywhere, right? 10 years ago, intelligence wasn't AI, right? Maybe some people were thinking about AI. Intelligence was just compute everywhere, a ubiquitous compute. Um, fast forward 10, 15 years, now it's crazy that we have this mature, super low power technology at the same time where power is getting so important to adoption of AI everywhere.
Absolutely, absolutely. That this is I mean it's a good segue to the topic that we'll talk about in a couple of minutes. But before we jump in, I want to say to the audience, if you have any questions to Carlos and myself, do feel free to put them into the chat or the questions section, and we'll make sure to get to them towards the end in a nice little Q&A session. Now, Carlos, before we talk about the power efficiency topic, one thing that I wanted to highlight is that recently in Embedded Worlds, you guys won the Embedded World AI Awards. Now, first of all, congratulations on that. This is really great to hear. Now, you won this for so-called Heart Kit. Tell us about Heart Kit a bit. What earned it that recognition?
Okay, so yeah, there's a couple of things here. One is when we think about body-worn AI and in general, just anything that's measuring the human body, um, if you're a data scientist, you get very excited, right? Because data scientists are driven by data. Like we're looking for this anything that has a rich source of nuanced data and a signal to be found in it. That's what we live for. And there's nothing more there's nothing that throws off more data that's more important to us and more nuanced than a human body.
Mhm.
Um, everything you do, like blinking, that throws off enormous amounts of data. Like just it tells you where you're looking, it tells you how healthy you are, and just multiply that by the rest of your body. And so I think heart is an easy target for this in terms of first understanding the importance of nuanced data. And also how do you build a product around that that's valuable to end users, from doctors all the way down to consumers. And so let me take an example of that, and then I'll kind of work my way into how we decided to develop Parkit. Can I share a slide real quick?
Yes, please go ahead.
All right. So when we think about a heartbeat, we all think about a heartbeat monitor. It's talking about, I mean, it's what you're thinking about is really every few milliseconds or every period, your heart's going to beat. That's sufficient for something like say I'm sorry, I'm talking and sliding at the same time is something I have not mastered. Let me switch the slides here real quick. Are you seeing the right one? I'm sorry, Samir.
It does shows the heartbeat.
Okay,
Uh, yeah.
good. So that is a nuanced signal, right?
Mhm.
A heartbeat is not a boom, boom, boom. It has all these other rhythms kind of built into it. If you're just looking for the strongest beat, or the traditional way of doing it is looking for the strongest frequency, you're going to find your heartbeat. If you want to do anything else, if you want to start finding the nuanced differences in how the different muscles in your heart interact, uh, then you need to segment the model. So yeah, segment the signal. So you start finding all these kind of, the doctors do this, right? They go up and they mark it on the piece of paper. Um, and then you look at it over a period of time, and now you look at dynamic behaviors of your heart. So every heartbeat is going to be slightly different, and all that data, it's just It's mind-boggling, right? How much data you can get through this, get out of this. And so we set out to build we hired a heart expert. We set out to build a nuanced model that did all this for us. And we showed it to customers. They were very excited. And then he said, can we do this? Right. It turns out that customers don't want a pre-built model. I mean, some do. Most customers want the toolkit, so to speak, to build their own models. And so that's where HeartKit came from. Um, After a lot of iterations, we decided, okay, let's take a step back from building a model zoo with something like this, and let's build kind of a Lego kit, right? So that customers can pick and choose what models they want to do. And so this is the model for this is the pattern that we follow for all our other AI kits, right? We give you a certain set of tasks for folks who are joining this maybe with less AI background. An AI task is the feature that you're implementing, right? What is it? It's important about the thing. So if you're doing, I don't know, a dog detector, the task is detection of dogs. In this case, the tasks are denoising that signal because a lot of body-worn sensors are very noisy. Segmenting that signal, just what I just talked about, and then using that segmentation to do things like AFib detection and arrhythmia and tachycardia and a bunch of other uh, conditions that we were able to detect. So that's kind of pre-built for you, but maybe you have a different sensor. So you have a different data set. We give you all the data set prep. We even give you synthetic heartbeat generators because you don't maybe have a huge, population of people suffering heart attacks while you have monitors on there. So, you can synthesize that kind of data. And then finally, because we don't know what's important to you ahead of time, we give you a whole family of library of neural architectures that you can do, use to create your own personal model. All right.
Impressive
And
stuff here. Oh
thank you,
yeah.
thank you.
Um, so one thing, and correct me if I'm wrong, you've open sourced HeartKit, correct? So how have you seen the response so far for this?
So we open source it for anybody who uses our hardware. It's on GitHub. There's no lock. You just go look at the code if you like. We trust you to follow the license. I it's overwhelming, right? We get a lot of inquiries from heart forward companies. Maybe they have a very good denoising algorithm, but they don't have a good AFib detection algorithm. So we mix and match. We get a lot of interest from universities as well. So this is a big time to market or accelerator to a university project's research program, right? A graduate student might want to use this. And I love that because that graduate student will be my customer a year from now.
Absolutely. And I mean it's really commendable to do that because this is a space where people or companies and or teams and research teams as well rely on one another to move forward, and it helps progress the technology really at a faster pace and a better way. So really great stuff there. Anything else we need to cover within the HotKit world before we move into the technical stuff? Because I really want to get into the technical questions in a bit.
Sure. And this I think is a bit of a lead into the technical questions as well. It's something that we don't emphasize when we talk about HardKit, um, is how insanely power efficient it can be, right? When you turn on all these models and you run them constantly, monitoring your heart, you can get about 35 days of that off a coin cell battery, like over a month of
That's impressive.
monitoring, running full AI, running all those four complex models.
Wow, I mean that's really impressive. That's a great segue to my next section because I want to talk about this power efficiency breakthrough in my opinion. So um, we all know battery life is or has been a major hurdle for remote monitoring devices, right? And it's a challenge that a lot of companies, a lot of people are dealing with. So how does Spot help sort of resolve this problem in a way that sort of enables this always on functionality that these devices require?
Okay, yeah, so that's great. So just looking at it from a practical point of view, we can get into why it works, and I think I touched on that a little bit before in
Yeah.
terms of how subthreshold and all the other stuff around it works. But the upshot is for our microcontrollers, you're able to get 3, 5, 10 times more compute for the same amount of joules. So think about it in terms of how much energy you're putting in, you're getting a lot more cycles. The way I talk to my data scientists and our customers is you have free MIPS, you have free micro, MCPS, megacycles per second. Use them, find a way to use them, right? In terms of AI, uh, first, there's more AI. I've talked to so many customers that had all these really cool models, audio models and so on, that were great demo models that they were not able to put into production because their battery would last a day. We've all heard of, some spectacular failures in the market because battery power, okay, this is very cool, but if you have to charge your glasses every hour, then it's not as cool. So especially for remote patient monitoring, that battery life is important. There's some of our customers talk about something called compliance, which is fancy doctor speak for patients forget to charge their devices, right? So if you're not complying with the device monitoring requirements, then that's a problem. If you charge it every day, that is a problem, because most people won't. So it's important for these things to last from a doctor appointment to the next doctor appointment. So that's one of the uses of the 10x, 5x, 10x better power utilization. But you can
Mhm.
also just add more models and make them more accurate. Like graduate from a heart rate monitor to a AFib monitor, for example. That's concrete from what we just discussed.
Yeah, yeah. I mean, speaking of that, like, and given that this 5x and 10x the efficiency that we're seeing here, can we talk about the AI workloads that are not possible
Mhm.
because of this, right? So you mentioned the heart, but I mean, as you said, the body is emitting all these, ton, I don't know, the really large volumes of data. So
Mhm.
can we talk about the workloads, the AI workloads that are not possible on these battery powered devices?
It's I mean, and it's almost limited by your imagination and your data, right? At this
Yeah.
point, if you can think about it and you can collect data for it, you can do it. And I'm just thinking about a conversation I had this weekend. I have some friends who are not AI kind of savvy. I'm like, hey, Carlos, I had this great idea for X. And you think about it for a second, I say, yeah, you can actually do that, right? Now, do you need to hire a PhD to collect or MD PhD to collect your data for you? Probably. But conceptually, technically, there is no limitation. The the exciting things, so I think remote patient monitoring and remote health is one of the most important things that we're seeing as a society today. We are, our demographics are shifting. A lot of our population is aging. We're not producing a ton of doctors to go live in everybody's houses, and people want to age in place. They don't want to go into, managed care facilities. To enable all of that, you cannot do it without AI. Yes, you can detect heartbeats. Great. But can you distinguish brushing your teeth from having a seizure? You need AI for that. Can you detect a real fall from someone lying down? You need AI for that. And if you go to online, you can find already hundreds of fall detectors. Where it gets really interesting and where you need more sophisticated AI, the stuff that we can enable is, did you fall and is there somebody in the room with you? Right? That's a different kind of emergency, right? If there's somebody in the room with you, there's probably a caretaker with you. Um, it's not whether you had a seizure or brush your teeth. It's how many times a day are you brushing your teeth? Because that is a very strong health indicator. One of the things
Mhm.
that people stop doing is self-hygiene. So that kind of patient monitoring where it's longitudinal, it's over many days, and it requires very nuanced models to distinguish between different activities is what these new AI models or this new power kind of superpower is enabling.
Impressive, and it's such a nice thing to hear that we're in this age of like, if you imagine it, you could do it, regardless of, the smaller steps that need to be done. But we are in that position today. So far we've talked about Hotkit as an example. We've talked about power efficiency. Another point within, let's say, the benefits of this approach is privacy, right? And this is one of the major challenges when it comes to technology, especially in healthcare, right? Healthcare, we're talking about sensitive data of patients. Now, um, how does Ambiq, or how does your approach enable the sort of more secure processing at the edge?
Okay, and that's a great question. We think about this all the time. It turns out, and if you're listening to this webinar, you probably already know this, right? But there are multiple advantages to moving AI to your device, to on-body, as close to where the sensor data is as possible. And I'll get to privacy in a second, but think about things like latency. A fall detector is no good if you're sending data all the way to the cloud, and 3 minutes later, you're like, maybe your mom fell. It's too late, right? You need immediacy, right? So latency by processing on board, that's very important. And for almost, I can't think of very many health monitoring cases where that latency is not critical.
Mhm.
And we can get into also hearing aids in a bit, where, of course, sub-millisecond latency starts getting critical as well.
Yeah.
Um, there's power efficiency. So again, we're Ambiq is just completely power obsessed. Turns out it's lower power to compute on the data locally than to send it over RF. So you save about 40% of your battery life by not sending your ECG data to a smartphone. And then there's privacy and security. If you think about the kind of data that we're operating on and the kinds of insights that we're operating on, okay, HeartKit, that's an ECG. But we're talking about things where they listen to your voice, not necessarily to the words that you're saying, and can detect early onset dementia. So just the patterns of your voice, the patterns of how you're speaking can give away a lot about your health state. And that is now you start getting critical. Do you really want a large conglomerate knowing this? Or do you want your phone to talk to you and your doctor only? That's
Yeah.
where it gets critical. Um, and then there's one more thing that is uh, probably something that's impacting your audience as well. When you compute in the cloud, you have to pay that cloud. Your Amazon bill could get pretty chunky.
And it's not
So
cheap.
as you're starting out, maybe it makes sense. But once you scale out, like one of these big customers that are handling, tens of millions of end customers a month, that can get that's significant. So you reduce your overall operating expense by moving
Mhm.
to the device as well.
Well, since we're talking about reducing cloud dependence, there are certain techniques, right? Like, for instance, looking at local sensors, and sort of the technique called local sensor fusion, right? And stuff like radar as well. How do you see these techniques? So what role do you see these techniques playing in reducing this cloud dependence? What like maybe I mean, we've talked about an aspect of this, but let's dive a little deeper into it.
Yeah. So almost all of these kind of health related things will involve some form of sensor fusion. Um, Simple things like inertial detectors, well, even that is fusing like 6 dimensions, right? Um, but where it gets really interesting is where something is listening to you and monitoring your muscles and uh, muscles are your movement, um, and also maybe monitoring some environmental signals. And the more fusing you do, the more dimensional your data gets, the more you compute. So we're solving that by lowering the power, the cost of doing that compute. Um, and you alluded to millimeter wave radar. So the opposite, the other side of remote patient monitoring that's not body worn, a lot of it will be body worn, is instrumenting your house. So you're living in your house, you don't want to go into a remote on-site care. you start putting sensors in your rooms. Now, the early implementations of these were cameras.
Mhm.
And understandably, people get very nervous if you have a camera pointing at your bed or at your toilet in every room. This is where millimeter wave radar comes in, because really what it looks like is a motion sensor. It doesn't have a camera. There's no lens. It can't really see your face. It can't really understand the position of your body, but not any of the personal details. And so people are a lot more comfortable putting these millimeter wave kind of detectors in their rooms. And if with the right AI, these things can do amazing things. This is the kind of stuff that can tell you, did you fall with somebody in the room? This can tell your doctor how many times you use the toilet. And this is, I know it's hard to talk about these things, but that is so important to health, right? Are you drinking enough water? So it can, with the right AI, with a sophisticated AI model running on that puck, you can actually deduce a lot about the health of your patient in that house without giving away too much privacy.
Yeah, yeah. Uh, I mean, while you're speaking about this, the thing that's on my mind is like we're talking about real-time insights. We're talking about privacy, right? We're talking about power efficiency. Put these all in one bucket here. On the other bucket, we have the actual performance, right? That's the realistic sort of balance between, minimizing cost, minimizing cloud dependence, all that stuff, and making sure privacy is established, and the actual performance of the device. How
Mhm.
do you balance these? Are there any trade-offs, or sort of what is your approach? Because I mean, we've seen so many different technologies, so many different companies try to tackle this challenge, and it remains a challenge. So, what's your approach to it?
Okay, so in AI, performance can mean two things. It can mean latency or it can mean accuracy.
Yeah.
And so what often happens is that you choose a smaller kind of model, something that will fit on an edge device, to do the initial analysis, right? You don't need to send ECG data every second to a cloud for analysis. You only need to send it when something interesting happens, right? So when an afibrilal situation happens, you turn on the radio and you alert the doctor and you send them the ECG and the doctor can do the next level thing. Or maybe the cloud. Cloud has a much more sophisticated, huge, multi-watt. For us, multi-watt is amazing, right? I talk about microjoules, not joules. Um, Model to do a fine discrimination of what actually happened. But for 99% of the time, really, you're doing human anomaly detection. You're looking for interesting things that happened in a sea of non-interesting, hopefully not interesting things. Um, so my mantra is always the right compute in the right place. We find for time series, for things like motion and health and heart, I haven't found a model that needed more than what our MCUs can provide. As you get more sophisticated, perhaps, then maybe you do a little bit on the device, and then you split it with the cloud where needed.
Right, right. Um, really interesting stuff. And actually, this hybrid relationship between the edge and the cloud is it's such a valid solution for a lot of applications, including healthcare, because you'll be benefiting from the real-time, low latency aspects of the edge. And at the same time, while that is happening, giving you quick real-time decisions, you can rely on the cloud to do any analytics and any stuff that require more compute that can give you more like feedback apart from the instantaneous things that you require, which is good for doctors as well. In a longer period of time, let's say. But as we're talking about this, I mean, you've mentioned a lot of different sort of applications, which is great. I mean, these are really exciting applications for this. Where do you see sort of the most momentum in terms of adoption of this technology? We've talked about wearables. We've talked about elderly care, elderly care. Sorry. We've talked about fall detection, all that kind of stuff, or even chronic illness management. Uh, in your opinion, in your experience so far, where do you see the most momentum when it comes to adoption of this technology?
I think it's a moving front. I think there's so much exciting things happening that are borderline science fiction that it's hard to say that there's one place that's exploding. except my email box. Uh, so we've talked about body-worn AI. One thing that we haven't touched on is the hearing related AI. I see a lot of science fiction like stuff happening there as well. Um, and that does require really kind of interesting levels of compute to the point where you can't do it unless you have very efficient battery power.
Mhm.
Um, I there is a lot of there is a race to the top. I like to say this, there's a race to the top. Like one company puts out this really sophisticated AI behavior, everybody now has to match that behavior. And so we can, from a practical point of view, what we're seeing is the beginnings of what I call semantic hearing. All right. So let's think about, let me take a step back. A few years ago, um, active noise cancellation was the big deal. It was a killer app, right? In the hearing aid, not hearing aids, earbuds kind of devices. It'd been around for decades, but it became a consumer, you know, uh, priority. If you don't have it, you're not going to get bought. Um, Pretty recently. Um, what I'm seeing now is the next step of that. Okay, you cancel the sound. How do you let sounds back in? Some sounds are important. The implementations today are not so good. My hearing devices detect if I speak, and then they turn off noise cancellation, which is fine in a conversation. But if you're in an airplane, suddenly you get this, you know, burst of
Right.
sound every time you talk to the flight attendant. So you need something more nuanced. You need something that knows what a voice is, takes that voice alone and passes it through. So we're already seeing that. It's called speech enhancement or speech denoising, and then you mix it in with ANC. That is very important for some kinds of hearing aids. Like hearing aids are designed to amplify all noise. But if you're in a conversation, you want only the conversation through. You want all the dinnerware and the restaurant sounds, all that to go away. That's really hard. It turns out, well, you need an AI that tells you that you're in a restaurant and that you're in a conversation. That's one kind of model. We
Mhm.
call that acoustic environment detector. It's super hard. It sounds like an easy thing, but restaurants and airplanes and subways, when you're listening to just nothing, they sound the same, right? They kind of to
Well,
if I played three clips from three different places, it would be hard for a human to detect that they're different places. So you have that, and then you have the kind of the thing that extracts speech from everything else and lets it through. So that's, I think, where the state of the art is now.
mhm.
And then you look at the research. We're very sophisticated semantic hearing. So I can say I only want to listen to Samir, and it knows your voice, and it tunes out all the other voices, and I only listen to Samir. So imagine that you're somebody who does have a hearing deficiency. That is going to be extremely useful to you to carry on a discussion with your wife at a crowded restaurant and so on. So this kind
Yep.
of stuff. That's the research part has been solved. Now we're just solving the practicality of the compute side of it.
Yeah. I mean, really impressive. And I mean, even in terms of adoption, it's not just the actual technology working and doing its effort, but it's also people's perception of the technology and how they sort of allow it into their daily life and whether they accept it or not, right? Whether they feel it's foreign to their daily experiences or not. That's always a critical element of adoption. Um, so if we want to look to the next few years, and actually, before I do that, just another reminder to the audience, feel free to add your questions. We'll get to the Q&A session very soon, so please do add your questions so we can get to them by then. But yeah, if we look to the next few years, right? So you mentioned how research is developing, you mentioned how adoption is happening, or at least the practical aspect of things. Where is Ambiq in this position? How are you evolving your technology? Is it primarily focused on body-worn AI? Are you focused more on home-based health, right? You mentioned sensors as well. Where do you see the next few years for Ambiq?
That's a great question. the value here, right, is that we're extremely low power. So it really, the flip side of that is AI needs a lot of power, right? So if you're going to do sophisticated AI, you need that power advantage. And so Ambiq is just executing on that strategy. So we know that low power will always be important. We are always driving that down. Every generation of Ambiq processor gets a lot more performance. The last jump was about a 10x performance improvement in terms of AI specifically. So keyword spotter is running 10 times faster. Your speech denoiser is running 10 times faster. And at the same time, we lowered the power about 4x, 3 or 4x from our comparing against ourselves, right? We're our worst competition, right? We we take our sockets away from ourselves, which is always a good position to be in. So we're going to continue to execute on that. Along with this, so one of the interesting things is that you need more memory. The more sophisticated models need more memory. In the embedded space, that means an external device. That's bad because external devices have wires and they're wiggling and they use a lot of power. And because we are power obsessed, we don't want to do that. So we're looking for solutions in that space as well. Basically, we're just pushing that envelope that we already have an advantage in every direction.
Oh, interesting. Really interesting. I mean, while you're talking about that, I'm just thinking, so healthcare is it's such a highly regulated space, right? It's something that requires um, uh, you know uh, compliance, but at the same time requires a lot of collaboration of different elements of the ecosystem as well.
Mhm.
So do you foresee, or how do you foresee collaborations between, let's say, device makers, technology providers, healthcare providers, silicon companies? How do you see that becoming more and more crucial? In your experience, how has it been so far, and how do you see it in the next few years?
I mean, that's a really insightful question. You're right. This is not something that one company can solve, and no company should be trying to solve. We operate mostly through partnerships. So we have partnerships with companies that dedicate themselves to sensor, like body sensors, not just body sensors, of course, all kinds of sensors. Just happens that those are real, the, the data coming from a body is so sophisticated that they all apply. Other than putting a camera in your face, uh, everything there is valid. Um, we also partner with some health kind of OEM type companies. A lot of our companies are in the health and fitness space.
Mhm.
So the companies that we've worked with. So they're actually kind of bleeding edge. Some of these smartwatches are basically walking health devices. They don't just tell you how many steps you took that day. They tell you if you're twisting a foot, or if your gait is off, or if your gait is changing over time. Um, so it's not a big step for them to go to, and you've seen some announcements recently, probably go from here's how you're running to here's a lot more information about your health. Um, Not all device, it has to be like FDA approved. Oh, medical devices that are specific for medicine are FDA being the United States regulator, but there's other, of course, worldwide, there's different regulators. And we let our customers, you know, if they want to deal with that pain, they deal with that pain. We help by being inherently private and secure.
All right. Great stuff, Carlos. Thank you for this really insightful conversation. Now, let's jump to the Q&A and see what kind of questions we've received from the audience. So, please, as we answer some of the questions, feel free to add any of your questions that you have as well. But this has been really interesting, Carlos. Let's check one of the questions that I have here is focusing on barriers to entry, right? So, uh, put another way, where can innovative health AI companies create value in this space?
Okay, so the good news is these models are not the $10 million like DeepSeek, DeepSeek made noise about, okay, they train a model for 6 million. No, these are $2,000. No, my desktop computer is $2,000 and it takes a day to train a model or 2 days. So if you're a data scientist and you know AI, the barrier to entry then becomes data, right? Um, a lot of us, there are, because universities and hospitals like to collaborate, there are a lot of rich public data sets that are not encumbered, that you can use them as long as they're not commercial. You can use them to produce your models. For the more edgy stuff, like I briefly mentioned, detecting dementia, um, that does take a sophisticated data set and labeling, right? So really depending on how far you are from the standard, excuse me, from the standard, oh, no, it's not resolving. From the standard data sets, you may have to put a lot more effort into creating your data set.
Right, right. Oh, interesting. I do have another question here, and it's more focused on protocols. So this person is asking, after you've locally analyzed the data that, say, you don't want or cannot analyze a device, you have to, look at transmitting that data. So what transport and application protocols do you use for that?
That's very application specific. Most of our customers will split their application, smartphone, wearable, so on. And it really depends on what kind of data you're transporting.
Okay, yeah,
In
interesting.
terms of the RF, we support Bluetooth, right? BLE and variants, so that you would just kind of packetize it there.
Mhm. Um, and we've talked a bit about sort of the next few years and the sort of the expected applications as well. Um, but on the horizon of Edge AI health in general, what kind of so-called killer apps do you see or do you envision well, maybe in the next year, couple of years? Because I mean AI is advancing really so fast that now I don't know which time frame to use anymore, you know. So how do you
It's
see?
crazy, yeah. It's hard to keep up. I and this may actually fall into the start from the patient health and move into consumer. One, we touched on this, right? The semantic hearing. Um, I can see a very near future where you're attending a concert, very loud, maybe you're a very loud venue like a bar or something, and we all grew up yelling at our friends, trying to get them, hearing their conversation and getting them to hear our conversation. I think that's going to be a thing of the past. I think we're going to get to a point where a single knob on your hearing pods will let some amount of music through if you're at a concert and some amount of conversation through, and you will, uh, be able to tune that to you went to a loud concert, maybe you want loud music. I think we're going to get to a point where you won't remember how it was to not have that,
It's
right?
crazy to imagine, really.
Well, the same way that if I ask you when did YouTube start, most people will get it wrong. People have been, YouTube is around forever, but no, it's pretty recent.
Yeah.
So we will get to that point in technology, and I think it'll start with a sophisticated hearing aids because that is a critical feature for over-the-counter and medical hearing aids, and it will move into the consumer space pretty quickly.
Really impressive stuff. Carlos, I do want to say thank you so much for this discussion. I appreciate it. I've learned a lot today. Really, really great stuff. And to the audience, just a reminder. So we've had the 2025 Edge AI Technology Report that actually speaks to what Carlos has been talking about today when it comes to digital healthcare, and it speaks about other applications and other industries as well. So go check it out if you haven't already. It's in the comments. You can check the link there and download it for free. And you can even see Ambiq's featured piece in that report, which is really, really insightful as well. So, Carlos, thank you so much again. Really great speaking with you, and I'm really looking forward to continuing this discussion at some future point as well. And to the audience, thank you for joining us. We hope you find it insightful as well, and I really look forward to seeing you all in the next webinar. Thanks. Cheers.
Thanks, sir.